CGHS के अंतर्गत आधुनिक एलोपैथी चिकित्सा, होम्योपैथी और दूसरी भारतीय चिकित्सा प्रणालियों जैसे आयुर्वेद, यूनानी, सिद्धा और योगा आदि द्वारा उपचार किया जाता है। आइए अब आपको बताते हैं CGHS द्वारा प्रदान की गई सुविधाओं के बारे में। CGHS के वेलनेस सेंटर में OPD की सुविधा है।
Hello, am I audible?
Hello, am I audible? Hello?
Yes,
Hello?
ma'am.
Okay, sir.
नमस्कार, CGHS में आपका स्वागत है। केंद्रीय सरकार स्वास्थ्य योजना केंद्र सरकार के कर्मचारियों, पेंशन धारकों और उन पर निर्भर पारिवारिक सदस्यों के स्वास्थ्य की पूरी देखभाल करती है। CGHS की शुरुआत सन 1954 में हुई थी। तब से ये लगातार उल्लेखनीय। नमस्कार, CGHS में आपका स्वागत है। केंद्रीय सरकार स्वास्थ्य योजना केंद्र सरकार के कर्मचारियों, पेंशन धारकों और उन पर निर्भर पारिवारिक सदस्यों के स्वास्थ्य की पूरी देखभाल करती है। CGHS की शुरुआत सन 1954 में हुई थी। तब से ये लगातार उल्लेखनीय रूप से बढ़ती गई। आज भारत के 80 शहरों में लगभग 42 लाख लोग इसका लाभ प्राप्त कर रहे हैं। CGHS के अंतर्गत आधुनिक एलोपैथी चिकित्सा, होम्योपैथी और दूसरी भारतीय चिकित्सा प्रणालियों जैसे आयुर्वेद, यूनानी, सिद्धा और योगा आदि द्वारा उपचार किया जाता है। आइए अब आपको बताते हैं CGHS द्वारा प्रदान की गई सुविधाओं के बारे में। CGHS के वेलनेस सेंटर में OPD की सुविधा है। साथ ही दंत चिकित्सा और दवाइयों आदि की भी सुविधा है। इसके अलावा पॉलीक्लिनिक, विभिन्न सरकारी अस्पतालों और CGHS के पैनल पर मान्यता प्राप्त अस्पतालों में विशेषज्ञों की सलाह भी प्राप्त की जा सकती है। CGHS के अंतर्गत इन हाउस लैब्स हैं और एक्सरे यूनिट भी हैं, जहां रोग निदान यानी डायग्नोस्टिक और इमेजिंग सुविधाओं का लाभ मिल सकता है। हमारे डॉक्टरों की सलाह के साथ साथ आयुर्वेदिक, होम्योपैथिक, यूनानी और सिद्धा प्रणाली के अंतर्गत दवाइयां भी प्रदान की जाती हैं। ये सब भारत सरकार के आयुष कार्यक्रम के तहत आता है। कुछ चुने हुए सेंटर या अस्पतालों में परिवार कल्याण, मैटरनिटी यानी प्रसूति और बाल स्वास्थ्य संबंधी सेवाएं भी दी जाती हैं। आउट पेशेंट डोर यानी OPD और इंडोर उपचार, जांच यानी इन्वेस्टिगेशन और ऑपरेशन या दूसरे प्रोसीजर्स की सुविधाएं भी उपलब्ध हैं। इन सब के लिए सरकारी अस्पतालों, मान्यता प्राप्त अस्पतालों, लैब्स और इमेजिंग सेंटर में जाना पड़ता है। इमरजेंसी के समय इलाज करवाने पर सरकारी या दूसरे अस्पतालों में खर्च किए गए पैसे का भुगतान भी किया जाता है। साथ ही कान की मशीन, आर्टिफिशियल लिम्स या उपकरणों के लिए खर्च किए जाने वाले पैसे का भी रीइंबर्समेंट यानी भुगतान किया जाता है। CGHS पैनल वाले अस्पतालों और उपचार केंद्रों में पेंशन धारकों और दूसरे मान्य लाभार्थियों के लिए कैशलेस या बिना भुगतान किए उपचार की सुविधा भी उपलब्ध है। कामकाजी दिनों पर सभी वेलनेस सेंटर सुबह 7:30 बजे खुलते हैं और दोपहर 2 बजे बंद होते हैं। केवल देश की राजधानी दिल्ली में ही वहां के 4 वेलनेस सेंटर में इमरजेंसी यानी आपातकालीन सुविधाएं उपलब्ध हैं। सरकारी छुट्टियों वाले दिनों में सभी वेलनेस सेंटर बंद होते हैं। अगर कभी एक साथ लगातार 3 दिनों की छुट्टियां आ रही हैं तो वेलनेस सेंटर लगातार 2 दिन से ज्यादा समय के लिए बंद नहीं रहेंगे। याद रखें, वेलनेस सेंटर के बंद होने से 15 मिनट पहले यानी 1:45 बजे रजिस्ट्रेशन बंद कर दिया जाता है। फिर भी किसी गंभीर रोगी को अटेंड किया जाएगा। कृपया हमारे वेलनेस सेंटर में प्रवेश करते समय स्क्रीनिंग स्टाफ को अपना पूरा सहयोग दें। रजिस्ट्रेशन काउंटर पर कतार में खड़े हों। हमेशा आपका CGHS ओरिजिनल प्लास्टिक कार्ड या कलर प्रिंट आउट आपके पास होना चाहिए, या फिर मोबाइल पर माई CGHS ऐप या डिजी लॉकर की मदद से अपने कार्ड को रखें। रजिस्ट्रेशन काउंटर पर जाकर CGHS लाभार्थी की पहचान या ID प्रस्तुत करें। आप किसी भी CGHS स्वास्थ्य अधिकारी को दिखा सकते हैं, बस टोकन उपलब्ध होना चाहिए। रजिस्ट्रेशन के तुरंत बाद आपके रजिस्टर्ड मोबाइल पर SMS और ईमेल ID पर एक ईमेल प्राप्त होगा जो आपके अपॉइंटमेंट की पुष्टि करेगा। इसमें आपकी क्रम संख्या, आपके लिए चुने गए डॉक्टर का नाम और अपॉइंटमेंट का संभावित या अनुमानित समय आदि का पूरा विवरण होगा। CGHS लाभार्थी GDMO से 72 घंटे पहले ऑनलाइन अपॉइंटमेंट भी ले सकते हैं। और याद रहे, विशेषज्ञ या स्पेशलिस्ट को दिखाने के लिए आप 1 महीने एडवांस में अपॉइंटमेंट ले सकते हैं, पर उसी दिन का अपॉइंटमेंट उसी दिन ऑनलाइन नहीं दिया जाएगा। GDMO के साथ ऑनलाइन अपॉइंटमेंट लेने वाले लाभार्थी को रजिस्ट्रेशन काउंटर पर कतार में खड़ा नहीं होना है। वो दिए गए समय पर रिपोर्ट करे। याद रहे, अपॉइंटमेंट टाइम का मतलब है आपके वहां पहुंचने का समय, यानी रिपोर्टिंग टाइम, ना कि डॉक्टर से मिलने का समय। जब भी आपका टोकन नंबर पुकारा जाए, आप डॉक्टर के कमरे में जा सकते हैं। इसमें समय लग सकता है। 75 वर्ष से ज्यादा उम्र वाले वरिष्ठ नागरिक या सीनियर सिटीजन अपने रजिस्टर्ड मोबाइल फोन से CGHS हेल्पलाइन पर फोन करके अपॉइंटमेंट ले सकते हैं। हेल्पलाइन नंबर है 180020888900। 80 वर्ष से ऊपर की उम्र वाले सीनियर सिटीजन और डायलिसिस वाले रोगी तथा गंभीर रोगग्रस्त लोगों को भी आउट ऑफ टर्न अपॉइंटमेंट के लिए प्राथमिकता मिलेगी। साथ ही नौकरी पर जाने वाले सेवारत कर्मचारियों को सुबह 9:30 बजे से पहले प्राथमिकता दी जाएगी। बस आपको ड्यूटी पर उपलब्ध मेडिकल ऑफिसर को सूचित करना होगा और फिर अंदर मौजूद रोगी को देखने के बाद आपको प्राथमिकता मिल जाएगी। याद रहे, हमेशा शांत रहें, ऊंची आवाज में बात न करें और अपने मोबाइल फोन को साइलेंट मोड पर रखें या फिर बंद कर दें। जब आपका टोकन नंबर पुकारा जाए तो आप डॉक्टर के कमरे में प्रवेश करें, अपना CGHS कार्ड और प्रिस्क्रिप्शन और सभी जरूरी कागजात, रिपोर्ट आदि अपने साथ लेकर जाएं। वहां मौजूद चिकित्सा अधिकारी पूरी जांच और रिपोर्ट आदि देखने के बाद उपचार शुरू करेगा। और हां, दवाइयां ऑनलाइन मॉड्यूल के द्वारा दी जाती हैं। इस सब के बाद डॉक्टर आपको दवाओं की सूची यानी प्रिस्क्रिप्शन का प्रिंट आउट देने का प्रयास करेंगे। अगर आप चाहें तो कंप्यूटर पर CGHS.nic.in पर जाकर भी अपना प्रिस्क्रिप्शन पा सकते हैं। आपके रजिस्टर्ड ईमेल आईडी पर भी ये प्राप्त हो जाएगा। और हां, जिन दवाइयों के आगे D लिखा होगा वो फार्मेसी में उपलब्ध होंगी और आप उन्हें उसी दिन 1:45 बजे से पहले प्राप्त कर सकते हैं। ये दवाइयां अगले 3 दिनों तक प्राप्त की जा सकती हैं। और जिन दवाइयों के आगे I लिखा हो वो फार्मेसी में उपलब्ध नहीं होंगी और आपको लोकल इंडेंट द्वारा अधिकृत दवा विक्रेता से मंगाकर दी जाएंगी। इंडेंट की गई दवाइयां आपको अगले दिन देने का प्रयास किया जाएगा। आपको इन्हें खुद कलेक्ट करना होगा 15 दिनों के भीतर। अगर दवा उपलब्ध न हुई या अगले दिन छुट्टी हुई तो आपको प्रतीक्षा करनी पड़ सकती है। अगर आपने समय सीमा के भीतर दवाइयां नहीं ली तो वो अनक्लेम्ड श्रेणी में चली जाएंगी और किसी और लाभार्थी को दे दी जाएंगी। हमारा निवेदन है कि और प्रिस्क्रिप्शन का प्रिंट आउट फार्मेसी के अधिकारी को दें। जैसे ही दवाइयां दी जाएंगी, आपको एक ईमेल या कंफर्मेशन एसएमएस प्राप्त होगा। फार्मेसी काउंटर छोड़ने से पहले अच्छी तरह जांच कर लें कि दवाइयों की मात्रा ठीक है और दवाइयां सही हैं। महंगी और स्पेशल इंडेंट वाली जीवन रक्षक दवाएं स्टोर से प्राप्त की जा सकती हैं। कृपया अपना CGHS कार्ड और प्रिस्क्रिप्शन दिखाएं। CGHS लाभार्थी या किसी अधिकृत व्यक्ति को ही दवाइयां दी जाएंगी। काउंटर छोड़ने से पहले दवाइयों के नाम और मात्रा की अच्छी तरह जांच कर लें। याद रहे, जिन दवाइयों को विशेष ठंडी जगह में रखना हो उनके लिए स्टोर इंचार्ज के निर्देशानुसार विशेष आइस पैक का इस्तेमाल करें और फिर रेफ्रिजरेटर में रख दें। नर्सिंग अधिकारी आपका ब्लड प्रेशर और नब्ज आदि की जांच करेगा। आपको इनहेलर के इस्तेमाल और इंसुलिन इंजेक्शन लेने के सही तरीके के बारे में भी मार्गदर्शन और प्रशिक्षण भी प्रदान करेगा। जिन वेलनेस सेंटर में लैब होगा वहां आपको अपना CGHS कार्ड और प्रिस्क्रिप्शन दिखाना होगा। जब आपको टोकन मिल जाए तो आप सैंपल कलेक्शन सेंटर में जाकर अपना सैंपल जांच के लिए दे सकते हैं। अगर आपको एक्सरे के लिए जाना है तो वहां भी अपना इन्वेस्टिगेशन मेमो प्रस्तुत करें। साथ ही एक्सरे टेक्नीशियन के निर्देशों का पूरी तरह पालन करें। और हां, अगर आप संतुष्ट नहीं हैं या कोई शिकायत है तो कोई बात नहीं, CMO इंचार्ज से संपर्क करें। CGHS में आने के लिए आपका धन्यवाद। अधिक जानकारी के लिए हमारी वेबसाइट पर जाएं cghs.gov.in। फिर एक बार आपका आभार। CGHS, नौकरी के साथ भी, नौकरी के बाद भी।
Thank you, Didi. Ma'am, we'll start in 2 minutes. Can you please switch on your mic and the video? Thank you. Ma'am, shall we start?
Yeah.
A very warm good afternoon, all my dear colleagues. Today we are here to discuss a very important topic, that is the golden 1,000 days of life. To have this talk, we have with us Dr. Ritamoni C Baruah, who is a pediatric specialist in Safdarjung Hospital in Delhi. On behalf of everyone, I welcome you, ma'am. As we all know, that the first 1,000 days of life, that is the period from the point of conception till the child's second birthday, is often considered the most critical period in the growth of the child. The correct growth for a solid future, to help the child thrive, these 1,000 days are very critical. It's a very critical window period which ensure that in the long term the child has adequate growth and development. So, without further ado, I hand the session to ma'am. I request all our participants that if there are any doubt pertaining to the topic, please type it in the chat box and we will take it at the end of the session. Over to you, ma'am.
Hello. Good
Yes.
afternoon, everyone. Thank you, ma'am, for your kind introduction. Today's my topic is Golden 1,000 Days of Life. So before going to the subject proper, I want to say about the what is well-being. Well-being is the experience of health, happiness, and prosperity. It includes good mental health, high life satisfaction, a sense of meaning of purpose, and ability to manage stress. Unfortunately, it appears to be declining. See, today's unborn child are going to be tomorrow's responsible citizen. So, what evidence shows that when young children are well nourished, cared for, and protected from diseases, violence, and toxic stress, they have the best chance at a thriving future. So, as mom said that it is 1,000 days is very important from the period of conception till 2 years, pregnancy to 70 days, first year 65 days, and second year 365 days, total of 1,000 days. And today I'm going to talk about the introduction, rationally to pick up the topic, impact on the society, fetal life, benefits of breastfeed, nutrition in the first 2 years, NFSS data versus the global data, brain development, toxic stress in early life, as well as the emotional health, and take-home messages. So, why are these first 1,000 days is golden? That golden word, I'm relating with that the first hour of emergency situation while managing the in casualty. Like that, this first 1,000 days also very golden because it is a unique window of opportunity to shape the healthier and prosperous future. It is the most crucial time for the development of the body, brain, metabolism, and immune system. So, first 1,000 day, it is first coined by FSI 360. FSI 360 is a Family Health International 360. It is a global organization that mobilizes research, resources, and relationship so that people everywhere can assess the opportunity they need to lead full healthy life. Presently, they are working more than 60 countries. They first launched the first 1,000 day in 2010. It began its work as a partnership with Bill and Melinda Gates Group, etc., multiple renowned foundations. Their mission is to make the healthy and well-being during first 1,000 days of life a policy and funding priority, both US and around the world. Definitely, first 1,000 days influence the policy, practice, and public awareness to improve the well-being of the women and children worldwide. Sunala Hazardin means the Golden 1,000 Days campaign run by the Nepal government in collaboration with UNICEF launched in 2014 to fight with malnutrition. In India too, most of our programs are around 1,000 days, and though they are not giving the name, but in 2022, our National Health Mission, they have launched one app, that is Palan App 1000. It consists of journey of first 1000 days and focuses on the physical and mental growth and cognitive development of the children. So why this topic? So this is a common yet a very critical and crucial topic that requires our understanding. Our practices are directly or indirectly associated with this golden period. Directly, that we all doctors, as a doctors, as a pediatrician, as a gynecologist, we are directly associated with this segment of the population. Indirectly, as a family person, as a community person, as a part of the policy, we are associated with this golden period. So achieving both physical and mental well-being is a lifetime goal, and many of the challenges in adult society have their roots in the early years of life, including major public health problems such as the obesity, heart disease, mental health issues, etc. So these first 1000 days, as we know that the ability of a child to develop, learn, and thrive is significantly impacted by how well, how poorly mothers and children are fed and cared for. So nutrition is one of the crucial components, as we know. And in fact, this is the period where the foundations of their long-term health are set. So if adequate nutrition is absent during first 1000 days, what happened? There will be impairment of the physical growth as well as the cognitive development. There will be definitely results with malnutrition. They will be prone to illnesses. Again, it will result in greater loss in the GDP for treatment. Again, if there is cognitive development is impaired, the child will be not able to able to learn properly. So low educational performance leading to low economic productivity. Again, previously as we talked that non-communicable diseases in adult life, the risk is increases like diabetes, hypertension, neuropsychiatric illnesses, osteoporosis, cancer, etc. So we know that healthy mother gives the healthy baby. The beginning of life starts with the conception. According to the Constitution, the age of the marriage must be respected. Parents should be well prepared with good mental and physical health. The health of the preconceptual period, especially the weight of the mother, as well as the lifestyle of the mother, has also a significant impact. So, hunger starts at womb. Mother's food intake has no effect on embryos for up to 2 weeks. From 2 weeks onwards, mother needs extra energy, extra protein, extra iron, extra calcium, and other nutrients like folic acid. Folic acid should be started from periconceptional period to the first trimester of the intrauterine life till death. Because it prevents the neural tube defect. Again, iodine also important component of our nutrition, because if there is deficiency of iodine during intrauterine period, then there may be decreased IQ in later life. So, as researchers said, the basal metabolic rate increases by 5% during first trimester and 12% during second and third trimester. So nutrition is a crucial component of this first 1000 days. So mother needs balanced diet, as we know, as well as stress-free environment. Stress-free environment not only at home, also in working places. So antenatal period is the most sensitive period, and a receptive period. During antenatal visit, mother should be educated what are the benefits of the breast milk, what is the benefits of good nutrition, hygiene, parenting advice, etc. Mother should assess the breast milk support group so that they can help in early establishment of breastfeeding. As well as all hospitals should be followed the 10 steps of baby-friendly initiative. So, 10 steps of baby-friendly initiative. What are they? So, all hospitals should have a written breastfeeding policy that is routinely to be communicated with all healthcare staffs. Train all healthcare personnel in skills necessary to implement the policy. Inform all pregnant women about benefits and management of the breastfeeding. Help mothers to initiate breastfeeding within half an hour of birth of the baby. So mothers how to breastfeeding and how to maintain the lactation even when they are separated from the baby. Like a baby is in the NICU, then also. Give newborn infants no food or drink other than the breast milk unless medically indicated. Practicing rooming in, allow mothers and infants to remain together. Encourage breastfeeding on demand and give no artificial teats and pacifier, and foster establishment of breastfeeding support group. So, what are the breast milk benefits? All we know, it contains living cells, it contains immunoglobulin. So it is the first immunization. It is a potent medicine. It is safest and healthiest, as we know. It increases, forms the bonding. It creates the emotional bonding between mom and the baby. So, as researcher says that intelligence score of the breastfed babies are more higher than that of the counterpart who are fed on artificial feed. Again, breast milk definitely it is economic. It is a complete food. It contains all the nutrients that baby need to grow for at least 5-6 months. It protects against allergies. Breast milk provides a distinct bioactive molecule that contributes the immune maturation. Healthy microbial gut colonization secures a strong immune system. It prevents diarrhea and pneumonia. It reduces indigestion problem. So for mother also there are so many benefits like reduces risk of bleeding, reduces risk of breast and ovarian cancer. It has a contraceptive effect. It reduces osteoporosis. Then faster weight loss after the childbirth. So many benefits we know, but do you know what is the rate of exclusive breastfeeding rate in India? It is around 55 to 60%, and globally it is around 40%. What WHO statement it announces that breastfeeding is an unequal way of providing the ideal food for the healthy growth and development of infants. It also an integral part of the reproductive process, which is very important. As a global health recommendation, infants should be exclusively breastfed for first 6 months. And after that, to meet the evolving nutritional requirement, infants should receive nutritionally adequate, safe, complementary food while breastfeeding continues for up to 2 years or beyond to achieve the optimal growth, development, and health. So nutrition in first 2 years, according to IFP recommendation, as we already talked about it, that initiation of breastfeeding as early as possible, exclusive breastfeeding, appropriate complementary feeding, then hand washing with soap. That is, hygiene is very important, especially in India. Soap and water at critical times. Critical times kya hai? It is includes before eating or preparing after using the toilet. Avoid junk food. Home food should be preferred over artificial, commercial, and tin or packaged food. Promote and establish human milk banks. It's very important in upcoming full immunization and vitamin A supplementation with deworming. Effective home-based care and adequate nutrition and anemia control for adolescent girls, pregnant and lactating mother. Effective implementation and monitoring of IMS Act. What is IMS Act? IMS Act is the Infant Milk Substitute Act. and other laws related to child nutrition. So we know the importance of the breastfeeding. We know the importance of the benefits of the breast milk. But you see the causes of under 5 mortality. In this slide we are showing that in fact you see more than 40% are expired within newborn period, within 28 days. And do you know what is the mortality rate? Mortality means now in India, 11.3 million breathed last before they reach the 5th birthday. And as I told that more than 41% they expired within 28 days, and more than 1/3 you see this is the premature babies. Premature babies, they die early within 28 days. And you see all the causes, under 5 mortality causes, most of are preventable. Most of are preventable. Just our government is doing great, but you see what are the preventive measures? As we know that preventive measures, this is good antenatal care. Just recapitulate. Just recap. Preventive of postpartum parent to child transmission of the infective diseases like HIV, other infective diseases. Having a skilled attendant at birth, it is very important. Institution deliveries. Nowadays, institution deliveries, they are high as up to the 88% because of our ASA workers. They are doing the great job. Early initiation and exclusive breastfeeding, rooming in, KMC, immunization, complementary feeding, potable water, sanitation facility, use of ITNs. What is ITNs? Insecticide treated nets, so that we can prevent malaria, dengue, etc. and treatment of diarrhea, pneumonia, etc. So all these are preventable causes. Just this slide, I'm showing that what is a global scenario in less than 5 years. I have taken it from the WHO site. Previously, I told you that about 40%, 40 to 44% exclusively breastfeed till 6 months in global scenario. In India, it is 55 to 60%. It is much better. 149 million are stunted as a result of chronic malnutrition in the first 1,000 days. 49 million acute malnutrition patients become susceptible to life-threatening illnesses and infections. Now another form of malnutrition is coming, that is obesity. So I'm showing here some NFSS data, National Family Health Survey data, comparing with the NFSS 4 with the NFSS 5. See the children less than 5 years, anemia, and anemia is increasing. Previously it was 58.6%, now 67.1%. And same is happening with the non-pregnant and pregnant ladies. Previous from the NFSS 4 data, that rate of anemia is increasing, and overweight also increasing. Overweight, obesity, both are increasing. Why? Because of our lifestyle, because of our more affinity towards the junk food. So anemia is increasing than that of the previous data. But definitely we are good in neonatal mortality rate, infant mortality rate, under 5 mortality rate, they are decreasing than that of the previous data. See the MMR, that is maternal mortality rate. Previously it was 130 per 1 lakh of the live births, now 97. See this MMR I am comparing with the developed countries. See in developed countries how much it is, and we are in where we are. We are much more lagging behind that of the developed countries. So our national health mission is doing great. Our ASA workers are doing great, but where we are lagging behind. Sometimes I feel that care of pregnant is a half-hearted attitude. As a part of good birth rate, 25.8 million women are registered as a pregnant per year. Only 58% receive the mandatory 4 antenatal checkup. And it is all unequal, means it is not equal in every state. Bihar, you see, 14.4% only, lowest. And anemia is continue to increasing. So prematurity is increasing, then increase the postpartum hemorrhage, again mortality and morbidity increases. So where we are going, I think education is the key to success of all government and non-government initiative programs. Are you agree with me? So now I'm going to talk about the brain development. This is very important. Along with the physical growth, what is development? It is the acquisition of skills. Is very utmost important. It is very important. Which starts at birth. But basic form of learning like habituation, it starts inside the fetal life. For example, fetal movement increases in response to sudden auditory tone, but decreases with repetition. It is called habituation. So, brain development means not only the cognitive development, it also includes the social, emotional, and able to perform the executive functions in later life. All of we know that brain grows quicker than that of the body. More than 80% of brain develops within 2 years of life in terms of weight, size, and capacity. Brain not only requires the right nutrition but also needs the prevention of infections and optimum psychosocial stimulus. So here I am showing sensory pathway, language, and higher cognitive function. You see that highest peak all are within the first 1,000 days, within the first 2 years. So just let me recall about embryology of the brain growth. From ectoderm, first the neural plate forms, then neural plate, it folds, it becomes neural tube, and from neural tube forms the central nervous system. And by 8 weeks, gross development of the brain occurs, like forebrain, midbrain, and hindbrain. But in cellular level, the neuronal migration occurs. Neuronal migration occurs, that is 6 layers of the cortical cells. They completed neuronal migration by 6 months of age. But the cells are differentiating, cells are growing. Do you know adult brain contains how much of cells? How much of neurons? It is about 100 billion neurons. And each neuron has average of 15,000 synapses by 3 years of age. And this velocity curve I am showing, that is brain growth velocity curve, I have taken from Nelson, a different component of the brain. And this one is the solid 2 peaks I am showing. This solid 2 peaks, it depicts a rate of rise of DNA, that is marker of the cell number. And it is dashed line, that is showing the weight of the brain. And other single peak solid line, it shows the level of cholesterol in the brain. It is a marker of myelinization. So cells are growing, brains are growing. So cells cells are differentiating, cells are replicating, as well as the axon and dendrites. They form synaptic connections at a very rapid rate during this first 1000 days. So any stress during this period, it definitely has effect on growing brain. So do you know that children brain can create 700 neural connections in every second throughout this 1000 days. 700 to 1000 new neural connections every second. And this connection of the 2-year brain provides the foundation for the future, because it is twice busy that of the adult brain. See, child brain is growing, new connections are happening. New connections depends upon the exposure and the environment. Whatever environmental stimulus they are getting, that connection, new connections are happening. So, young brain take less time, less repetition to learn new things, but adult brain who are already formed, they takes more time and must efforts to acquire new skill and knowledge. So external stimulus is very important. For example, if one infant is having strabismus in one eye, strabismus, that is both the eyes do not able to line up in the same direction. So I become lazy. That it is called amblyopia. That eye is not getting the stimulus. So that from the eye to the brain, that connections are not developing properly or not working properly. To stimulate the lazy eye, what ophthalmologists do, they do the patching of the normal eye. So if patching is not done in early childhood, then what happens? It will be difficult to correct in later childhood. So again, stimulus is very important. Early environment and exposure has influenced not only the fundamental architecture but also ongoing connectivity and functionality. Another term, there is synaptic pruning. If connections are less frequently used or not in use, it become atrophic. Like for example, in 0 to 2 months, you may notice that infant cry in response to the cry of another infant. It is interpreted that it's an early sign of empathy development, but child is raised in an environment where lack of empathy, then child may not be empathetic in later age. There is another term is the plasticity. What is plasticity? Plasticity is the brain's unique ability that so there is two type of this plasticity: synaptic plasticity and cellular plasticity. Synaptic plasticity, that means strength of individual connections, and that is lifelong. But cellular plasticity, it is the variation in number in connections, which dramatically decline after 5 years of age. So, what shapes the developing brain? With advances in neurology, genomics, including epigenetics, molecular biology, social science, a more accurate model has emerged. It is eco-bio-developmental framework. Ecology, that is the social and physical environment. Biology, that is the biology of the child in first 1000 days. It interacts. In ecology, there is a family, how family is responsive, how mother or parents are responsive, relationship, again, broader aspect, that is community, how then in broader aspect, that is the national policy or in national level. So, ecology, biology interacts and it is cumulative over time. Biology of the health and development. So, what is the outcome? Outcome, it depends on the physiologic adaptation or disruption. And it will show the health and development in later stage. What is epigenetic changes? Epigenetic means when environmental toxic stress interacts with the gene, it causes modification of gene, genetic expression, modification of genetic expression, but there is without change of DNA sequencing. There may be DNA methylation, there may be histone acetylation, but there is no changes in DNA sequencing. It is called epigenetic changes. It may pass to the next generation, future generations, not only the next fetus, to the third generation too. So another genetic changes, that is telomeric length. What is telomeric length? So you know that chromosomes are there, and that cap of the chromosome, it is called a telomere. And with chronic stress, the telomere, it is seen that telomeric lengths become shortened, and it implicates aging, it implicates short lifespan. So early stress, that on mother. So early stress, as we know, that food insecurity, medical diseases, depression, anxiety, everything, abusive relationship, drug abuse. What happens in utero? It will cause the high level of cortisol in amniotic fluid. If there is lack of tender care in first 2 years also, what happens? Again, there will be physiological changes of hypothalamo-pituitary axis. And there is sympatho-adrenal medullary axis also disrupted. So brain function as well as brain structure changes. There will be definite negative effect on cognitive development of the child, and in later childhood we get the child as a flight and fight mode, short attention span, that is ADHD, attention deficit syndrome, learning to struggle in learning, unable to develop healthy relationship, depression, anxiety, shame or frustration, everything we are seeing the mental health issues. What is the allosteric load? Allosteric load is a wear and tear effects. It happens because of dysregulation of metabolic functions, which will affect the inflammatory as well as the immune dysregulation. So we know from these slides, we know that how these stresses affects the child. So creating right conditions for early childhood development is more effective and less costly than that of the addressing problems in later life. See, many times in utero environment is not in our hand, or we know that in utero environment contributes greatly but not completely to the future growth and development. So we have after delivery of the baby, if the child get the right conditions, that the baby can thrive well. It is seen that those who are at risk or they are in high risk to get the developmental disability, if they get the right conditions or right environment and tender care, they are thriving well. For example, if there is placental insufficiency of any cause, lithodysia baby, then if the child received medical intervention during NICU stay, and they received good love, if the child received a good loving care along with breastfeeding, then definitely that child is it is seen that he is doing well, and there is less developmental disability. But in the same condition, if mother had depression, mother is not giving feed frequently, infrequent feeding, malnutrition is affected, the child may develop failure to thrive as well as some developmental issues. So how can we prevent? Definitely promoting breastfeeding. Already we talked about breastfeeding. Positive parenting, it is very important. Then quality of relation and attachment. Consistent nurturing interactions. Many times we see that the child is gone through a very harsh environment from poverty, but they have done well in later life. When you go to the personal histories of this type of child who overcome the poverty and as well as any harsh environment, often they have at least one trusted adult, whether parent, grandparent, or teacher, to whom the child had a very special relationship or bonding. They feel safe, they feel protective. So stimulation in the safe and protective environment is very important. So parenting, positive parenting, as we know, that tender loving care, reading aloud to the children, playing and singing together, eating family meals, family outing, warm supportive approaches during conflicts, etc. But that most of our children are from poor socioeconomic condition, they cannot afford to go family outing, and parents are mostly busy with their working. Their living life is hand to mouth. They cannot think of outings, but there are some traditional things like singing lullaby, baby talk while mother is breastfeeding, then isolating. There are some traditional things that massage of the baby, oil massaging. It also very good stimulating thing, and in some practices that baby and mother kept together for first 40 days, where child receive good stimulation from mother, and breastfeeding also established very nicely. So what are the 5 R's for early childhood education? It is routine, reading together, rhyming, rewards, relationship. Reward, that praise is the powerful reward. So for families also, there should be support, there should be social connections, knowledge of the parenting and child development, ability to foster nurturing and attachment. And for communities, there should be safe neighborhoods, safe progressive schools, stable and safe housing. There should be access to the medical care, and at least inclusion and equity related to the race, ethnicity, and disability. Inclusion is very important. They should not feel left out. So our government is doing great things. National Health Mission, they have, I previously told you, they launched this app, Palan App 1000, It is launched on 2022, 16 August at Mumbai by Union Minister of Health, Dr. Bharti Pravin Power. It is designed to promote age-appropriate parental engagement in children. It contains beautiful videos. We can ask parents to download this app, and in fact it is a platform for the parents to raise any questions. All questions they can raise, whatever they have in their mind, and it is answered. And so I am concluding my topic. And what is the take-home message? We are Homo sapiens in identity. That is, Homo sapiens means wise man. There should be right start to get the bright future. We as parents, grandparents must ensure the right environment so that our children's brain and bodies blossom to their full potential. Each day of the first 1,000 days is special and influences the way the child develops, grows, and learns, not just now, but for the entire life. As a professional and public healthcare provider, we can work together to ensure the best outcome for young children and their families. In a larger picture, intersectoral action is critical to optimize brain development and overall health and well-being. Thank you for your patience hearing. Okay, ma'am.
Thank you, ma'am. That was a very informative session. We have a few doubts in the chat box. One of them being, as we were discussing about the critical period when there is the neural development in the child, and how important that period is. Can we give some advice in our day-to-day practice to our to the expecting parents as to how or the precautions that need to be taken so that the brain development of the child is not affected and it's optimal?
First of all, previously, as I told previously, that mothers should be healthy, and they should prepare before getting pregnant or before the conception. They should be mentally and physically prepared. That is number one. And there should be good nutrition, definitely. And mothers should get good environment, both at home as well as in the working place. They should not be in stress, first of all. And before that also, anemia should be taken care of. And mother should be in the good lifestyle. This is a good nutrition, as I told. Then after delivery, that baby should be breastfeed as early as possible. Breastfeeding education we should give to the mothers during antenatal period, so that we can increase the percentage. After that, actually one person at home should be dedicated to the child. Every cues, every questions, every need of the child to be taken care of by that person, whether it is a mother, whether it is a grandmother or grandfather. One should be a dedicated person, and baby talking, then talking to the child, and singing, at least reading together, and reading to the baby, because you see the language development, it occurs in first 1,000 days. In fact, when, for example, I am seeing that one mother is from West Bengal and father is from Tamil Nadu, and they are staying at Delhi. So they're both sets of grandparents. They used to come very frequently. So the child can communicate by 2 years. He can communicate both set of parents as well as their parents. Their parents, they used to speak English, so he can communicate. Language development, it takes time, but understanding and communication by non-verbal or verbal, whatever the form, they can communicate by 2 years of life. So that receptive power is very good, and that synapses, they are growing, and brain cells are also growing. So new connections are developing in that time. So most of the stimulus, if we give within 2 years, that definitely there will be good outcome in the later life.
Thank you, ma'am. Ma'am, there was another query regarding the time when around 6 months of age, we generally advise shifting to solid to semi-solid food and reducing the breast milk intake. A very common issue that parents raise to us in the OPDs is that the child is heavily dependent on breast milk and they're finding it difficult to wean the child off. So, are there any advice that we can give to the parent at this point of time? Because, and does this influence the child's growth over dependence on the breast milk?
So we should praise the mother, definitely, that mother is continuing breastfeeding, and along with the breastfeeding, after 6 months, they need the nutrition, that food. Okay, because as we said previously, that infant should nutritionally adequately complementary food should be given. So mother should be actually aware of this nutrition. We can give education as well as we can show. Many OPDs have the nutritional counselor as well as staff nurse who can show that how liquid, how semi-solids are there, how liquids are there. First, the counseling, that not only the breast milk is not adequate, it is adequate till 6 months, but after that we need complementary foods. That should be balanced food, that is nutritionally adequate. So we have to show them, we can demonstrate them how to make it, how that baby will definitely refuse in the first phase, and but by singing, by playing, you can that mother may take at least 1 hour to 2 hours to give one feed, and how much feed to be given, and how liquid is there, how semi-solid is there. It should be actually in OPD basis while they are coming to the immunization. We can give that education, and it is going on actually. Many hospitals have that nutritional counselors, and they show how to make it. They show the nutrient contents of the day-to-day, that is daily basis, means what we are using at home, like dalia, we are using dal saul, and how to make it, how much it should be means liquid, how much proportion to be given at one time, and that ghee to be added, and how fruits to be given. It's like that, and it should be consistent actually. That if baby refuse in one time, that we should not we should not conclude, that mother should not conclude conclusion they should not conclude that baby is refusing the food. The one type of food we should when we are starting, we should continue for at least for 1 week, and again another type we can introduce in the second week, like that. But breastfeeding to be continued till 2 years or beyond, along with that of the complementary feed.
Okay, thank you, ma'am. And the last question for today is, ma'am, if we compare how children were brought up in the past decade compared to now, a very important difference is the advent of technology. Especially these days, it is observed that a lot of parents, when the kid is throwing a tantrum or is upset, they just hand over a phone or a tablet with a video or something playing on it, and they then complain that the child is mostly always into electronic devices and then is not eating properly. So,
Yeah.
is there any advice on how to reduce their screen time and how that is affecting the growth?
Actually, screen time should be limited, and up to 2 years, I think, while talking to the children or baby, we parents should not use also. You have seen that so many parents are more with the gadgets rather than giving time to their children. So first of all, we have to show we have to guide, we have to be a role model for them, and while giving food, there should not be any gadgets around like TV or mobiles, and we can talk, we can sing, we can read aloud, and we should go to our previous generations what they did. And nowadays, all tantrums are increasing, and especially the autistic disorder. We are seeing so many autistic children nowadays because of very early use of gadgets. So it is not recommended to use gadget while giving feed, and we should avoid it. And parents especially, they also means limitation, use can be limited actually while it is needed mostly. Otherwise, if we give children to play with a laptop or mobile, then definitely that child will be engaged with that gadgets, and he will not interact with the environment, and he will not talk to the other things, because it is very addicting, as you see. And I think
Thank
that
you.
message is going.
Yes, ma'am.
Thank
you, thank you, ma'am, for clearing those queries. Those were the comments in the chat box, so we can wind up this session. I thank ma'am for giving us such an informative talk on a very important topic about the initial days of a child's growth. They are truly the golden period that we should all focus upon. I also thank all the participants during the CME for their active participation. We'll meet next month with another topic. Till then, thank you everyone. Take care.
Thank you, Dr. Rita, and thank you everyone.